All right, I am back with my Matthews hat on and my Knock On t-shirt. Knock on. I think I'm wearing this in quite a few videos. Maybe I need to get more clothes. I don't know. I wear like the same 3 things every week, just kind of rotate them in and out. But anyway, I do change my underwear once in a while. Chapter number 11, Adaptations to Aerobic and Anaerobic Training. This one focuses more on the aerobic side of things. There's a little bit of the anaerobic training adaptations towards the end of the chapter, but most of this is going to be dedicated to the aerobic side of things. There is going to be one figure. It's actually the second slide. It's like right after the title slide. If you look at it, you're going to be like, oh my God, what is going on? It's not that bad. Trust me, every semester I get these looks like, what is this? I always say it looks like the cheat code to Super Mario Brothers. You know, the different pipes and everything that goes through. But anyway, it's not that bad. We're going to actually go over most of it and explain most of it throughout the lecture. And we've actually already seen some of it, to be honest with you. So without any further ado, oh my goodness, without any further ado, here is chapter 11. Chapter number 11, Adaptations to Aerobic and Anaerobic Training. Now, I know what you're thinking. If you're looking at this slide, you're like, what is going on? What is happening here? But I can promise you, well, I don't know if I can promise you, but hopefully at least by the end of this chapter, you're going to understand most of what's going on here. This almost looks like a cheat code to Super Mario Brothers. If you're listening on your headphones, there is a lot of different things that's going on here, but basically we're going to see what happens to increase VO2. There's a lot of things that go into it, a lot of different pieces, and we're going to go over most of them. Some of them we've actually kind of gone over at least a little bit, but we'll go over them throughout this chapter, and that's kind of where we're going to end it, and kind of the whole point of this chapter. There's going to be a little bit of the anaerobic side of things, but most of this is dedicated to aerobic adaptations. So to start off, let's go over some terminology. It's always good to have some definitions of what we're actually describing. So aerobic training. This is the cardiorespiratory system that we're talking about here. And this is what we refer to a lot of times as cardio. So we're improving the heart function, lowering heart rate at a given intensity. That's what that essentially means, that improved heart function. There's some other things that are going on there too. Improve stroke volume, all that good stuff we'll go over here in a minute. But the lower heart rate at a given intensity is really the key factor. And we also have improved blood flow to the muscles, especially to the working muscles and the muscles that are being trained. We have improved respiratory functioning as well. And we also have O2 that is being utilized much more efficiently now, especially at maximal exercise or VO2 max, as well as during submaximal exercise. And then the other definition here that we need to describe is cardiorespiratory endurance. And that is just the cardiovascular and the respiratory systems working in conjunction to more efficiently deliver oxygen to the tissues. On the anaerobic side, these are short-term, high-intensity bouts of exercise. So we're looking at the ATP PCR system as well as the glycolytic system in this case. We can also talk in anaerobic terms about muscular strength and also muscular endurance, because even with strength training, most of that is going to be coming from anaerobic metabolism. And then on the muscular endurance side, we've seen in the last couple chapters, we have a sustained repetitive contractions of those muscles. So this is a little bit related to strength and power, meaning that somebody who's really strong is likely to have a high amount of muscular endurance. Not always, but there's a good likelihood. Now let's jump right into this with maximal aerobic capacity or power. And we're talking about VO2 in this case. So VO2 max, and this is the Fick equation again, VO2 max is equal to cardiac output max times AVO2 difference max. So we have a couple different components there. We have cardiac output, which is related to the heart function, heart rate times stroke volume. And we have a VO2 difference. That's the difference in oxygen concentration in the arteries versus the veins. And we did go over that in the couple chapters there related to the cardiorespiratory system. Now, how you know that somebody has reached a true VO2 max is that there's an increase in intensity. So that could be speed, it could be intensity, whatever it might be. There's an increase in the workload, but there's no subsequent increase in VO2, in the amount of oxygen that's being utilized. So over here in the graph, we can actually see that in both of these cases, the pre-training and the post-training, there was an increase in speed on the treadmill, but there was no subsequent increase in the VO2. Now, when somebody is training aerobically, there's going to be an increase in the oxygen delivery and the utilization of that. We'll go over some reasons why that is and the processes that take place for that to happen. Stroke volume is going to be improved. A VO2 difference is going to be increased as well. And we'll go over some of these physiological reasons why. Overall, somebody is able to perform at a greater intensity. In fact, over here on the chart, on the graph here, pretty much the simplest graph that I have in almost anything that I teach. And it just simply shows that VO2 max increases post-training. Duh, man. So that's what happens when we train aerobically, is we increase our VO2 max in that case. So we're able to exercise at higher intensities. And in fact, some of those submaximal intensities are now going to be higher than what our pre-training VO2 max was. Speaking of that cardiorespiratory endurance and the potential for it, let's look at submaximal endurance. So submaximal exercise is simply just a representation of a percentage of what the VO2 max is. When somebody becomes trained, one of the adaptations that they take on is that there's a lower steady state heart rate at any given exercise intensity submaximally. So it feels like they're doing less work. So their RPE at a given intensity is also going to drop down. Now, the best predictor for endurance performance is going to be VO2 with the addition of lactate threshold. And I've gone over this a couple different times throughout the semester. The VO2 is only part of the story. The lactate threshold is a bigger part of the story. Overall, though, submaximal endurance increases overall with aerobic training. Looking at the physical features of the heart size, the heart mass, especially the left ventricular wall, increases. The thickness of that wall in the myocardium of the left ventricle increases. The volume also increases in the left ventricle as well. Remember that the left ventricle is essentially the fuel injector of the body. That's where the blood is going to be last in the heart until it gets out to the rest of the body. And that is going to be one of the more important chambers of the heart. They're all four pretty important. But the left ventricle, that's the one where there's going to be a large amount of blood filling that up. And the muscles surrounding that chamber are going to need to be strong so that it can squeeze out as much blood as possible. Now, along with aerobic training, resistance training actually increases some of the left ventricular force and contraction as well. So there is some heart adaptations with anaerobic training, especially resistance training, but it's not going to be nearly as great with resistance training versus aerobic training, but it still does occur. Also, too, when we talked about some of the hormonal responses, and I had that one last slide looking at the training response and fluid buildup, or I wouldn't say necessarily fluid buildup, but there was an increase in blood volume, which actually decreased hematocrit, if you can remember back to that chapter. And that was all due to the plasma increase. And that plasma increase is now going to increase end diastolic volume. So there's going to be more blood coming back to the heart, more blood volume. That in turn is going to increase stroke volume. Looking at stroke volume specifically, we have an increased stroke volume because of our left ventricular volume increase. We have more end diastolic volume, or what we refer to as preload, along with that plasma increase. We have what's known now as a Frank-Starling effect or mechanism, which is an increased force of contraction. And if you think back to what that was, the left ventricle distends a little bit it's filling up with more and more blood. And it's similar to the skeletal muscles, in which if you have the muscle slightly stretched, it's able to contract more forcefully. So more blood fills up the ventricles, stretches them out a little bit more, and now it's going to squeeze back with the maximum amount of force that is necessary, especially compared to pre-training values. Now, stroke volume is increased at maximal exercise, at submaximal exercise, and at rest post-training. And the figure here just simply shows just that. There's going to be an increase in stroke volume at all three, at rest, submax, and maximal levels post-training. And we also have some data here with untrained, trained, and highly trained individuals in terms of the amount of blood being ejected by the heart. So the stroke volume and the stroke volume max in milliliters per beat. We have three other figures here. We have end diastolic volume and systolic volume and ejection fraction. Now, all three of these are going to be improved post-training. The end diastolic volume is increased, as we've seen in the previous slide. The end systolic volume, the amount of blood left over after the ejection, is less as we go up in intensity post-training. And the ejection fraction, the efficiency of getting as much blood out in one beat as possible, is also improved, especially at submaximal and maximal levels. Switching gears a little bit to the heart rate. Heart rate is not going to change based upon training values, based upon aerobic or anaerobic conditioning. That's simply just going to be based upon the individual and their age. Remember that heart rate max is 220 minus one's age. So the max is going to stay the same. It will change as we get older, but it's basically going to stay the same in a relatively short period of time. However, it will decrease during submaximal and rest. And why this is because there's a decrease in the amount of sympathetic nervous system response. And there's also an increase in the parasympathetic nervous system response. So we're lowering the heart rate at rest and at submaximal exercise, but it is the same during maximal exercise. So if we take what we've learned from the stroke volume and the heart rate and how they change with training, we can start to figure out, what's going to happen to cardiac output, because cardiac output equals stroke volume times heart rate. So at rest, stroke volume is increased, heart rate is decreased. They somewhat cancel out. So cardiac output isn't going to change all that much. It might slightly increase a little bit, but there's not going to be that big of a difference. It's not going to be significant. At submaximal exercise, stroke volume is going to increase, heart rate is going to decrease. Again, this is given intensity. Again, those cancel out. Cardiac output, not really going to change all that much. But at maximal exercise, heart rate stays the same, stroke volume increases. Therefore, the cardiac output is now going to increase at maximal exercise. In fact, that's going to be one of the major factors in determining VO2 max. Before we get into cardiac output, real quick about heart rate recovery. Heart rate recovery basically just means how well the heart is able to get back down to normal levels, normal resting levels following exercise. So the time to return to those resting levels is going to be decreased at max and submaximal exercise. So this is a really good predictor of cardiorespiratory fitness. If the heart is able to recover quicker, that means the heart is, more in shape, healthier, and that individual overall was likely healthier as well. So what I was saying before about the cardiac output, or the Q, this is the same during submaximal exercise and at rest post-training. There's a subtle change. Potentially it might increase a little bit, but it's not going to be very significant. Where we're going to see the significant increase is at maximal exercise intensity. And that is shown here on the graph. There's maybe a slight change in the amount of cardiac output at rest in submax, but it's not significant. And then it parallels the pre-training values up until we get to higher and higher intensities. And then once we reach max, we're far and above what we were pre-training. Now, some adaptations to the cardiovascular system to help to try to improve the blood flow, oxygen utilization. The blood flow itself, there's going to be an increase to the active tissues, to the active muscles that we're working during exercise. There's actually more capillaries that are going to be formed. So we build more vessels for that blood to flow through. So the capillary to muscle fiber ratio actually increases, meaning that we're able to get more and more blood to those tissues, those active tissues or the muscles during physical activity. There's also more recruitment of those capillaries. And when you look at the capillaries, they're about 1 cell thick. And having more of them means that there's more surface area for oxygen and carbon dioxide exchange. So there's an increase in the cross-sectional area now because you have more of those capillaries. So you can have more gas exchange, more blood and more gas exchange. And we'll get into here in a minute about, okay, that's all well and good if we can get more blood and more oxygen there, but can we actually utilize it? Can we actually do what we need to do and go through aerobic metabolism? We can, spoiler alert, but we'll see the reason why. Now, in terms of blood pressure, there's really no change to resting values. Really, the biggest change you're going to see is if somebody is hypertensive, they're going to lower their systolic, definitely, and also possibly their diastolic blood pressure. Now, their systolic blood pressure, though, is lower at a given intensity, usually, even in healthy people, especially at submaximal exercise and also at higher intensities as we get closer and closer to maximal exercise. How much that is going to change is going to depend upon how healthy the individual was prior to the training, though. And looking at the blood itself, the plasma volume, there's going to be an increase in plasma volume. Aldosterone is going to be released more and more, as well as antidiuretic hormone. That's going to cause more sodium and also water retention. And that's going to be used for sweating purposes, but also the sodium then is going to help to retain some of that water. And also we're going to be losing some of the sodium in our sweat. So we need to be able to have some in reserves essentially, and also to help keep some of the water in our bodies. So that increase in plasma then is going to cause a decrease in the hematocrit. So even though we have a decrease in the hematocrit, the total number of red blood cells is actually increasing at least a little bit. And depending upon how we're training, if we're training at altitude, it may increase that even more. But just regular training at sea level, that's going to increase the number of red blood cells at least a little bit. But we're still going to decrease the hematocrit slightly because we're going to be increasing the plasma volume. So the viscosity of the blood actually decreases, and that's going to help it flow a little bit better through the cardiovascular system. Looking at the lungs, some of the respiratory adaptations that occur, there's really not a lot of change at rest. During submaximal exercise, we're going to be breathing in less air. We're going to feel like we are at a lower intensity than maybe what we really are, at least compared to the pre-training values. So our RP is going to be less. We're not going to be sucking in as much wind as we were pre-training. Now it's going to be increased at max because we're now at a very high intensity. We're at a much higher intensity than we were pre-training value. So we need to bring in more oxygen. So we're going to be taking in deeper breaths, and that's also going to be more rapid breathing as well. In terms of the total volume of air coming in, that is likely not to change at all. There might be some slight increases because of maybe some of the respiratory muscles are now being more active, and there's an increase in the distensibility of the chest cavity to expand the lungs and fill them up with more and more air. However, there's very little evidence to show that there's an increase in, at least a huge increase, a significant increase in the volume of the lungs post-training. If you look at swimmers, elite swimmers, very highly elite swimmers, tend to have higher lung volumes than the average population. But the question is, it's kind of a chicken or the egg type of thing. Do they have high lung volume because of all the training that they've done during their swimming career? Or are they really good swimmers because they have higher lung volumes? It's likely that some of it might be a coincidence, but also that they were just born naturally with higher lung volumes. One condition I do want to get into, and this is kind of a neat condition. I mean, it's not, neat if you go through it. But these are going to be with highly trained, I'm talking very highly trained individuals that have a very high VO2 max. This is known as exercise-induced hypoxemia. Hypoxemia is basically hypoxia. There is less oxygen within the blood. But in this case, instead of being at altitude or maybe in a room where some of the oxygen has been sucked out, this is exercise-induced. This only occurs in highly trained individuals. At least that's what most of the evidence shows. If you were to have a condition or some sort of problem, this is probably, if you had to have one, like if there was some reason why you needed to pick a condition to have, this is probably the one you would want to have because you could probably brag about it. Essentially, these people are so in shape that their bodies can't keep up with them. So what happens is they are exercising at such a high intensity and they're breathing in so much air and their heart is pumping quickly and it's also filling up with a large amount of blood, that the blood that's passing through the system, through the cardiorespiratory system, doesn't have enough time to stay in the lungs for gas exchange because the heart is pumping too rapidly and there's too much blood volume going through because their stroke volume is really large and also their heart rate is high because they're getting closer and closer to max exercise, and they're also breathing in very deeply. Again, this only occurs in very highly trained individuals, but it can be a problem for somebody just depending upon the individual. Some of that's probably going to be based upon genetics, but so that's what exercise-induced hypoxemia is. It's just not having enough time for the gas exchange to occur in the highly trained individuals. Some other respiratory adaptations for the pulmonary diffusion side of things. There's really no change at rest or submaximal exercise. Now, there is going to be some increase at maximal exercise because we have more lung perfusion. There's more blood going to the lungs from the heart. We're at higher intensity. There's more blood coming. Cardiac output is increasing, and that cardiac output that's coming to the lungs is increasing. The AVO2 difference, which is the other portion of the Fick equation, is increased because we have more oxygen extraction. And this is going to be at all workloads. So rest, submaximal exercise, and maximal exercise. And it's going to be really, really significant at maximal exercise. Now, some of the reasoning behind some of these muscle adaptations and some of the just cardiovascular adaptations that we have a capillary supply increase. So there's increased capillary to fiber ratio. So there's an enhanced diffusion that's occurring. And this can actually be the limiting factor in VO2 max. The oxygen needs to get to the mitochondria. Again, going back to the increase in capillaries, great, fantastic. We can have more blood flow to the muscles. That's awesome. That's what we want. But can we actually use it? Yes. As long as everything is working properly, there's going to be an increase in myoglobin. So the numbers of myoglobin is going to increase. That's going to increase the oxygen delivery to the mitochondria within the muscles. Within the mitochondria themselves, they're actually going to increase in size, each individual mitochondria, but we're also going to increase the number of mitochondria in the muscle cells. This increases all the processes that occur in the mitochondria. And the biggest one there that we're concerned with aerobic exercise is aerobic metabolism, the electron transport chain, as well as the citric acid cycle. So the oxidative capacity is going to be increasing. Within those mitochondria, we also have those oxidative enzymes that are necessary for each one of those steps in the citric acid cycle and the electron transport chain. And those are going to be increasing because we have the increase in size of the mitochondria as well as the numbers. Because we have more efficiency at using oxygen now, we can spare glycogen. If you think back to chapter number 2, I believe it was, it's way back there. I believe also a little bit in chapter number 5, I went over this. The body uses glycogen and glucose more efficiently, meaning that we need less oxygen to use glycogen and glucose. However, we don't want to run out of that. And at lower and lower intensities, we tend to use more fat anyway, because we don't want to use the more efficient one until we absolutely need it at the higher and higher intensities. And that's the glycogen, the glucose. That's what we're going to use at the higher and higher intensities. At the lower intensities, when we have time for that metabolism to occur, the beta oxidation to occur, to break down the fat and go through aerobic metabolism, through fat metabolism, it's the same thing in this case. We have more efficiency at using oxygen post aerobic training. So therefore, we can use more and more fats for fuel versus carbohydrates at the lower and lower intensities. Now, at maximal exercise, we're going to use all carbohydrates anyway, but at the submaximal levels, and also maybe a little bit more at rest, we're going to be using more and more fats, in this case, post-training. Now, there's two different figures up here that I want to go over about lactate threshold, or the onset of blood lactate accumulation, which is just another name for the lactate threshold. Two different scenarios here, basically the same scenario. It's just simply looking at either percentage of VO2 max or treadmill speed. So both of them are representing an increase in intensity. And we can see the lactate threshold seen as LT, and we are increasing the percentage of VO2 max of where that lactate threshold is going to occur. And also on the right figure, we're going to be seeing an increase in the treadmill speed in which that will occur as well. So this is going to be the major factor in determining how well someone can perform in an endurance event, because they're going to be able to exercise at a higher intensity without fatiguing, without that lactate buildup. Some more on the metabolic adaptations. The respiratory exchange ratio, or that RER, that is lower at all workloads except maximal exercise. If you think back to chapter number 5, we learned that RER is essentially a representation of how much carbohydrates or fats that we are using. The lower it is, the more fats, the higher it is, up to 1, then we are using carbohydrates. At any given intensity, submax or at rest, we're going to be at a lower RER, which means we're going to be using more free fatty acids for fuel versus carbohydrates. So that's that glycogen sparing that I was describing a couple slides ago. Now, the oxygen consumption, the maximal oxygen consumption, is going to be increasing because of everything I just talked about for the past, 20 minutes, 15 minutes, however long it's been. There's an increase cardiac output, which is coming from the increase in end diastolic volume because of the increase in plasma volume. We have an increase in stroke volume, the ejection fraction, the contractility force of the ventricles. Also, the capillary to fiber ratio is increasing, which increases a VO2 difference. So all of that is playing a role in increasing maximal oxygen consumption and utilization. Now, some other little tidbits here, looking at the individual responses. Training status plays a major role in determining how well somebody is going to respond to the training that they're going to go through. If someone's lower trained, if they're out of shape, they're going to have a greater increase and a greater response to the training because they have a large range to go, because they're already, I guess you could say they're at rock bottom now. All they got to go is, or the only way they can go is up. Somebody who's already trained doesn't have that much further to go to reach their, genetic potential, essentially. Speaking of genetics, heredity plays a major role in this. And I say it all the time. If you want to be a world-class athlete, choose your parents wisely. But genetics plays a huge role in determining the finite VO2 range that somebody can achieve. How high that is, that's going to be up to the individual to try to get to that. Training is going to play a major role as well in how close they get to that range. Do we know exactly, or can we pinpoint somewhere in the DNA what that VO2 max could possibly be? I don't think, at least at this point, I don't believe we can. But you can maybe take some, common sense into this. If you have two parents who are world-class marathon runners, you probably can't have a high VO2 if you are their child. If you have two world-class power lifters, you may or may not be able to ever achieve 75 or 80 VO2. So just got to be, there's a little bit of common sense kind of involved in some of this. And we'll look at the identical versus the fraternal twin chart here in a second, or the graph, kind of an interesting study that they did. Gender also plays a role. Untrained females, their VO2 max tends to be less than somebody who is untrained on the male side. Now, a highly trained female is closer to trained males. So they're about 10% less. Even a female who is very, very highly trained, put up against a male that is very highly trained, they're still going to be less. So a lot of this is based upon blood volume, muscle mass, all that stuff. So it's nothing against certain genders. It's just kind of the way things are. That's just the biology of things. Now, when we look at high responders versus low responders in aerobic training, this was the twin study in this figure here. You have all these little dots kind of everywhere, these red dots. These red dots represent a set of twins. And on each of the axes, we have an increase in VO2 max, either for twin A or twin B. And if you look at each one of these dots, they're fairly similar. There's going to be a little bit of variation. So if you look at, there's one way over in the side here where twin A had an increased VO2 of 40% and twin B had about 29%-ish. There's another one here where twin A had 25, maybe 26% increase, and the other one had 21% increase. If you look at all of these dots, these sets of twins, they were fairly close in the amount of increase in VO2. There's some variation there, but for the most part, they were fairly close. But each one of the dots are scattered all over the place. It's the individuality. So the principle of individuality takes place here in the twins, and these were identical twins. The twins are going to respond similarly because they got the same DNA, but they're still two different individuals. They're going to respond a little bit differently. Some of that could be psychological, whatever it might be. But also, if they go through the same training regimen, all these different sets of twins, the sets of twins all responded differently to another set of twins. So that shows that there is still maybe some slight variation between twins within the twin group, essentially. But between the different sets of twins, there's a massive amount of variation. Switching gears a little bit to some of the anaerobic adaptations. So muscular adaptations, type 2A, type 2X hypertrophy as we are anaerobically training. Now there's going to be some hypertrophy of the type 1 muscle fibers, but it's not going to be nearly as great as the type 2 muscle fibers. And that should be somewhat obvious because the type 2 muscle fibers produce more force. Those are the ones we're going to be using quite a bit during anaerobic type of training, especially highly intense anaerobic training. When we look at sprint training specifically, and not talking about resistance training in this case, we could increase the type 2A muscles and also reduce some of the type 1 muscle fibers. There may not be a true conversion, but the type 1 muscle fibers are going to start to act a little bit more like type 2A muscle fibers. They're going to lose some mitochondria, and they're also going to increase some of the force production. And cross-training being the last little portion here. Cross-training, we're talking about doing more than one sport or activity at a time. If you attended a small high school, you kind of know a little bit about this. Sometimes sports interact with one another and you got basically two different sports going on at the same time. So quick little story or factoid, I guess. When I was in high school, my junior and senior year, I believe 8 of the 9 starting players in the baseball team also made districts in track. And track was at the same exact time in the spring as baseball. In fact, there were times where we would play a baseball game, and we would actually take a bus then to go to the track meet to do our events. Sometimes we'd have a baseball game, a track meet, and then a baseball game, basically Tuesday, Wednesday, and Thursday. Sometimes it's okay. I was a thrower and a catcher, so those were pretty anaerobic exercises, but I had a lot of teammates who were long distance runners, maybe even a mile runner or something like that. They weren't really sprinters because baseball is more of an anaerobic sport, so they were doing anaerobic and aerobic sports at the same exact time. So there was two different types of training that goes on with those. So how can this affect one another in terms of the training and the adaptations? Well, strength and power can be affected by endurance training, meaning that the more endurance training somebody does, they're not going to gain nearly as much strength and power as what they could is if they reduce the endurance training a little bit. So the aerobic conditioning is going to outweigh and trump some of the strength and power gains that somebody could possibly have. But on the flip side of that, the endurance benefits are not affected by strength training. Most often, the type, the volume, and also the intensity of the strength training is going to play a little bit of a role. And also whatever the endurance training is also going to play a little bit of a role. If you were watching the video, I had to actually edit one little spot here towards the end of this slide. The muscular endurance is going to increase a little bit with the endurance plus the strength training, and the type 2X are going to start going more towards the type 2A, meaning that they might gain a little bit of mitochondria. They're going to be used maybe a little bit more. It was actually reversed before I changed it. So anyway, type 2X is going to look a little bit more like type 2A. Now, this whole thing about endurance benefits not being affected by strength training, again, some of that's going to be, again, dependent upon what the strength training is and what the endurance training is. But it goes back to, I guess, my rant in one of the last chapters in the strength training chapter about some coaches for long distance runners. They say, oh, I don't want my athlete's strength training, even though it's still beneficial. The endurance benefits that somebody gets from their training long distance is not going to be affected by the strength training. Just kind of the way it is. The endurance training going to be perfectly fine. They're going to do super well in an endurance event if they're strength training. So if they incorporate some resistance training, it's still going to be beneficial for them. Now let's go back to this cheat code for Super Mario Brothers here and go through the different pipes and everything. Okay. I kid. Increasing VO2 max. We just went through a whole bunch of reasons. Let's look at some of the things here that we have that we've just gone over or gone over in the past. Let's look in the AVO2 side first. We have an increase in the capillary number, increase in the capillary recruitment, increase in mitochondria and oxidative enzymes, as well as myoglobin. All of that helps to increase the oxygen carrying capacity and utilization, which helps to increase AVO2 difference. We have this more auto regulation or vasodilation of the blood vessels. So there's a few different factors reasoning why the vasodilation increases. Some of that is going to be the nitric oxide production. Some of that was back in chapter something or other. I can't remember what chapter it was, but we talked about nitric oxide increases. Epinephrine is going to help to increase that. And also the sympathetic nervous system, but we have the myogenic, metabolic, and endothelial mediated factors going to help to increase some of that blood flow because of the vasodilation. That's also going to help to possibly decrease the afterload or the end systolic volume. We also have the muscle pump, the respiratory pump, the vasoconstriction, the sympathetic nervous system helping to increase the end diastolic volume or the preload. We have that increase in plasma that's helping to increase the preload. The hypertrophy of the left ventricle is helping to increase the preload, possibly increasing the contractility as well, as long as we're having enough end diastolic volume. We have an increase in sympathetic nervous system activity, increasing norepinephrine, the catecholamines released a little bit more. We also have more calcium being released from the sarcoplasmic reticulum, helping to increase the contractility of the heart. And all of this then is increasing the stroke volume. That stroke volume is helping to increase the cardiac output at max. So now on both sides of this, we have an increase in cardiac output max, and we have an increase in the AVO2 difference at max. So therefore, we have an increase in VO2 because those two are part of the Fick equation. Cardiac output times a VO2 difference. And as long as those both increase, or at least one stays the same and the other one increases, we're going to increase VO2 max. So it looks like a lot, but if you go through it, you can start to say, oh yeah, I remember that. I remember this. Oh yeah, the increase in muscle blood flow. Oh yeah, the vasodilation. You can go through all the different little pieces, and we've covered them at some point throughout the semester or in this chapter. Okay, chapter number 11 is a wrap. I'll see you in a bit. Okay, chapter 11. How did you like that? Wasn't that nice and lovely? There's actually quite a few slides there, but hopefully I didn't go over it too quickly. This is a chapter that I like to say this is how we get into shape. Because somebody always says, hey, I need to get in shape. Well, what kind of shape are you talking about? Round shape, square shape? I mean, what kind of shape? When we talk about getting into shape and going, running and heart health and all that stuff, that's getting into shape. Usually that's what we mean by that. This chapter explains physiologically what is actually happening. We have an increase in stroke volume, decreases in heart rate, cardiac output is changing, especially increasing at maximal exercise. Overall, our VO2 is now increasing, and that's kind of the whole goal. We also have some lactate threshold increases in terms of the increase in the percentage based upon the VO2. We have some other things too. We're creating more capillaries, increasing plasma volume. AVO2 difference is increasing, increase in myoglobin, increase in plasma, increase in red blood cells and blood volume overall, increase in end diastolic volume. All that good stuff is all increasing, and it all equals out to an improved aerobic endurance functioning, or at least aerobic power increases. So went over quite a few of those. There's really not, I guess, too much else to the chapter, but we did go over quite a bit of that. Seen some very simple figures in this one. Pre-training versus post-training values and a lot of different stuff. And it was pretty simple. You either increase or decrease pre-training versus post-training. There you go. I mean, it's really not too hard. Whatever, I guess a little bit on the heart rate recovery too. Somebody who's able to recover post-exercise much more efficiently. That's a really good indicator that somebody is very highly trained, but also their heart is very healthy. If it's able to get back down to resting levels in terms of the heart rate, is much more efficient in that case. And some of that is hormonally related. Some of it's based upon the structure, the structural components of some of the tissues, mostly the heart muscles. But a lot of that is just the heart is just more efficient, and the body's more efficient at clearing out some of that junk that's built up. Carbon dioxide, but also lactate as well. So you're not needing to suck in nearly as much wind versus pre-training values. What other stuff did we go over? I think it's kind of interesting too, the glycogen sparing. So I want to go over this one more time just in case you missed it. Of course, you could just go back and rewind it. Or rewind? Is there even a rewind anymore? Does anybody even have VHS? Probably not. Squirrel! If you think back to chapter number 5, I kind of went over this. I'm pretty sure it was chapter number 5, in which we need to use more oxygen to get the same amount of ATP from fats as we do carbohydrates. So we need less oxygen for carbohydrates. But if we're able to use and utilize more of the oxygen, because we have all these changes now, we have the increase in mitochondria, we have the increase in the capillary density, the capillary to fiber ratio, all these good things that are happening, we can use the oxygen more efficiently now. We're able to get in more oxygen, so therefore we can use more and more fats for fuel versus carbohydrates. We can spare the carbohydrates for later on when we need it at the higher and higher intensities. So that's the glycogen sparing, essentially in a nutshell. So we do increase lactate threshold, maybe some other things. The hereditary thing, again, genetics plays a huge role in how somebody's going to respond, but also what their upper limits are of what they can reach. There could be some drugs and performance enhancing stuff, which we get into in chapter 16, but some of that stuff, obviously illegal. Some of it could be natural too. Going to higher and higher altitudes possibly could get above that. And we've seen the twin study there, the differences between the sets of twins, but a little bit of variation between each of the twins themselves, but maybe not as significant as between the different sets of twins. So going into some of the genetics and the individuality concepts there as well. And then the cross training thing. Again, if you're training weight training at the same time as endurance training, then the weight training, the strength gains, they're going to be affected greatly by the endurance training. But the endurance training will not be affected by the strength training. So you can do both at the same time, just knowing that you're not going to gain as much strength as what you would is if you just focused in on the strength training, or at least reduced the endurance training quite a bit. So a couple things to keep in mind there, depending upon what training and what the goals are of the particular training. Then we went over the big cheat code slide again and increasing VO2 max, and just kind of went over some of the explanation of how all of that kind of plays a role in increasing the VO2 max, which was essentially the core of this chapter. So that's pretty much all I have for this chapter. That pretty much wraps it up in terms of like the main stuff. I'm going to have one more chapter here with chapter number 16 in ergogenic aids. But this kind of concludes our normally scheduled program. We're going to have a postseason. I don't know. I don't know if you put it that way. I'm not even sure, but we're going to have an additional chapter after this. So if you have any questions, comments about chapter number 11, please let me know. If not, I will see you on the flip side. Where that flip side is, I have absolutely no idea, but everybody stay safe and take care.